all these last few months where I have been building plan B and plan C and plan D, right? And I have been asking for opinions and for feedback and for help. And I have been blessed of having people like really helping me and teaching me and mentoring me for no reason, even for no money, to be sincere, just for the kindness of knowing that I am trying to do something that I really believe will be better for me, for my patients.
Have you ever considered a transition within your career? If you're anywhere within this spectrum, how did you sit down and plan for that next move? Well, today,
Dr. Miriam Zylberglait
will give us her story and her step-by-step how she made that transition. So you'll really want to listen, engage, and take notes. Welcome to another episode of The Worthy Physician. I'm your host, Dr. Sapna Shah-Hawk, combating burnout to reignite your passion for medicine.
Miriam, thank you so much for being on here.
Thank you so much for having me. I am a Peruvian girl. I grew up in Peru, went to medical school there, and 12 years ago, after being a physician for 10 years in my country, I met the love of my life. And even against my wildest dreams, I decided to quit my job in Peru and move to the US and start from zero here. So I had the opportunity to decide what I will be again, right? This time at 40s, my husband told me, what do you want to do when you grow up? And I don't know if for good or for bad, but I decided to do exactly the same career, medicine, the same specialty, internal medicine and geriatrics, and the same environment that was academia. So I guess nobody can have any doubts about how much I love what I do.
That's important. I mean, we're always told if you love what you do and you do what you love, then you'll never work a day in your life. But in medicine, it seems you can do what you love and love what you do, but there's still this crux, like this scarlet letter on the career of medicine and almost any specialty that really kind of follows us around. Because we're working within a system that is not allowing us to practice as humans. We have to crank out patients in and out of the office, almost like herding cattle, because I'm from Kansas.
It's heartbreaking for me because I love medicine and I love my patients and I love my students and I love being a doctor. It's in so many ways who I am, right? That's what I breathe every day. And I always dream that my kids will be doctors too. And today I ask myself if I will allow my kids to go to medicine, and that shows me how bad things are, because medicine is a beautiful career. And I don't think that we can see so many careers where we can be every day challenging ourselves, discovering something new, helping others, saving lives, having a very reasonable paycheck at the end of the month, and certain opportunities of teaching or doing research or writing. We can really do so many things, right? It's amazing. It's a big opportunity to develop skills, to show your skills. But right now, I feel like majority of us, we have been trapped inside of a gold cage and our wings are not able to be moved, and we don't feel like we can fly anymore. Humanity is not part of medicine in the majority of the cases, and for me, the reason why I went to medicine, why I am in medicine, is because I need it. I just, it's a very selfish comment, but I feel happy when I make someone else happy, and I feel joy and I feel proud of myself, and I feel alive when I can do something for someone else and I can make someone else to feel good. But right now we are seeing numbers, or we are forced to see numbers. We are forced to check metrics, and we are also being forced to forget about the art of medicine and the humanism and what I call vitamin for my soul. I miss vitamin for my soul.
I think you put it so beautifully there. Absolutely. Though medicine is a science, there's an art to applying that, because we're working with people. And that art really gets lost when we're looking at a computer screen and not at the person, or when we are having to check a box that has nothing to do with the patient-physician relationship or will not change the outcome with any of the treatment at all. And it's just something to mark off, to mark off.
Yeah, and not only delay the process of really helping the patient, but actually erase something that is so important in medicine, that is the relationship between the patient and the physician or nurse or whoever is taking care of them. Big part of good outcomes, or the reason why we get to the point of having good outcomes, depends on that relationship of trust, where not only that you will be able to collect the appropriate information, that the patient will tell you the truth about how they feel and they will be vulnerable in front of you, but where they will say yes to, your plans, even if they look uncomfortable or crazy. They will trust you. They will trust that you have your heart in the right place and that you are using the science for the benefit of them. But that needs to be cultivated. That takes time and effort. I cannot imagine telling a patient how to lose weight or how to sleep better or improve their mood in less than 15 minutes. When big part of these 15 minutes you are typing and clicking buttons, right? That means absolutely zero. These awful metrics, right? That I have no idea who create them. So yeah, it's hard to practice medicine in the right way right now.
And we're both internists, so this would translate to other fields for ophthalmology. I wouldn't trust you doing my cataract surgery or touching my eye if I didn't have that rapport with you. So it's also about building that rapport with the patient. Again, the patient-physician relationship.
Yeah, that's the number one stone in the building of medicine, right? Many times I have patients that will come to see me or just see someone else because they didn't feel comfortable with the doctor that was taking care of them. And the truth is that they were providing the same type of, treatments, and they were doing the same testings. Nothing wrong was when I go back and I see the plan of care. The plan of care was wonderful, but you have to assume that some type of disconnection happened, right, in that relationship, and sometimes it's just two individuals, though there's no perfect formula, right? You cannot force two individuals to connect, but majority of the times is related to the lack of time that we have. And the big problem is that physicians, we are being blamed of these behaviors, or we are being blamed of these situations, and that we are as victims as they are. And when you in a very vulnerable moment, you share not necessarily with a patient, but with someone from the community, right? That also is a patient for someone else. Like, this is medicine, and this is what happens to doctors and nurses. They will be like, no way. I saw that my doctor was mean. I saw that my doctor didn't care about me, but cares more about money. No, that's not reality. And maybe it's time for all of us, physicians, nurses, and other healthcare workers, to start raising awareness about what we are going through, and to have patients advocating for what is right for them, which means what is right for us too. Because we should be a team, patient, right, and physician should be a team, all of us working together for a good, positive outcome. And looks right now that instead of being a team, we are the enemies of our patients for something that we are not doing, that is not our fault, and is actually in the CEO office where they are cooking all this nightmare, right? Not in our offices.
That's an excellent point, because the truth is that we only have X amount of time before we have to move on to the next patient, the next patient, next patient. That's because reimbursement keeps going down. Insurance always keeps looking for loopholes not to pay for our services. And the truth is, the service to which we provide for the patient is not what drives up the billing.
No, and I feel that that is killing us as physicians. It's not surprising that we are seeing these very high numbers of burnout and depression. And the truth is that, especially when I practice in the Peru where I am from, to do 48 hours, in the hospital. Nobody will even ask if I feel good. I will have, conditions that were very below the ones that I have here in the US. Regarding food or a clean place to sit. I remember, sitting in the floor and trying to rest 2 minutes here, 2 minutes there, and having a blanket and a pillow in my car and some change of clothes in case I cannot go back. And I'm not saying that that is good. That is absolutely incorrect. Let's clarify. But I don't remember feeling so miserable. I was happy. I was proud of myself. I was excited. Because I was able to spend time not only with my patients, which for sure was amazing, but even with my colleagues, right? It was cool. Well, Happy New Year all together in the middle of the emergency and with a pizza. Who cares? But it was exciting. It was amazing. You were part of a family. Right now, we don't have even time to talk with our colleagues. The friendship that we used to have with those that are in the same hospital, in the same building with us, doesn't exist anymore. So we are forced to be isolated because we have so much work that we don't have time to be humans. And how we can live without being humans, without being connected, not only to our patients, but to other doctors or even to our family, because we go so tired home and in so bad mood that even at home we are not, a good company sometimes.
No, thank you for pointing that out and I want to reiterate what you just said, that we need to practice as humans. Humanism has been taken out of medicine. We really need to connect. We need the time to connect with patients. And that is work that we put in the forefront and maintain throughout the relationship in order to get great outcomes, which to the insurance companies, if you're listening, that's going to be a better cost savings right there. Because if it's a good teamwork and that good relationship, we're going to be able to keep them out of the hospital. So that's more money in your pockets. Having said that,
that is, I mean, before recording, we were talking about how new I am in the world of finances, right? But in my mind, when I do the math, looks obvious that better care for patients, better outcomes should save a lot of money, and that would be great for everybody, right?
It would, yes.
Right? That looks obvious. So what are we missing here? I ask myself, what is the CEO, the CFO of the hospital missing? What is the pharmaceutical director missing, and the director of the or the owner of the insurance missing about this? Why instead of following what is obvious, right? And we are going against that and causing so much trauma all over. I don't get it. I'm sure we are missing something here. Someone is getting some benefits because this is not random.
I was using sarcasm, right? Just because I'm going to make a ton of money with all this liability. I mean, most of us go into it because we want to give something back to humanity, make it a little bit better than we found it. We fill our cup by giving to others, and we're healers. And so when you take away that human connection, I think a lot of it is the corporations, the venture capitalists, and the insurance companies, the drug companies are looking at what they can give their investors now in this quarter, and not so much maybe more like Vanguard.
Yeah, and we are affecting the community in a very bad way, and that's what they don't know. And I believe that because of transparency and ethics, right, and so many things that are connected with seeing, patients should know that they are really not being treated in the right way. And there are many levels, not only now corporations and insurance and the prices and so many, these tiny fonts in the contracts with everything, because you have no idea even how much you will have to pay if you, right? It's a bomb waiting to explode. The Pandora box is in front of you. But then we have a healthcare worker force that is sick. So today you go to the hospital to an emergency, or to have your baby, or to have a cardiac surgery, whatever you need, and you have less than 50% probability of having a healthy doctor taking care of you. And that adds nurses and the rest of the team. So the probability of being in the hands of a doctor that is burnout, and burnout right now is a medical condition, right? It's now in the ICD-10, so it's considered a medical condition, a mental health condition even. So that it is explained as lack of energy, lack of motivation, and lower performance. So that means that you are having neurosurgery, right? Or you are being resuscitated, or your baby is being delivered by someone that is not motivated to be there, that is tired, exhausted, and that, by the way, is performing in a lower level than average. That is scary. I don't think that we will have people going inside of a plane with a pilot that has those conditions. You don't want a pilot that is tired, that is not motivated, and that is performing below average to drive your plane.
Oh, absolutely right. But that of physicians, nurses, and all the other healthcare workers that show up, when did you know it was?
At what cost, right?
Absolutely. Absolutely. And that's a great question. Now, how do we show that cost to the COO? How do we put a numbers figure to that? Because that's how they make decisions. It's I have an answer, and that'll be in the near future. But I mean that's the thing. How do we translate what we're talking about that is an intangible, and how do we make that tangible?
Yeah, I have a couple of very good friends in medicine using the term human capital, right? And trying to transform our value in numbers. I don't know if we will be able to convince the CFOs and CEOs. Sadly, I have the feeling that many of them, they are more influenced by the power and the money and the fear of change, and a lot of lack of self-awareness and social awareness, instead of really putting their ego on the side and starting to accept advice from those that are there in the OR every day, and in the room with the patients every day, and that see people suffering and dying, and etc. But I feel like the community, if the community starts advocating for themselves, if the community starts saying, I don't go to this group, or I don't pay for this, or I don't go to this hospital because of something, I don't know. I feel like people has power. I feel like communities have power. And educating them and letting them know the situation, and becoming allies with them, right? They helping us and us helping them, because our function is to advocate for our patients. It's hard to advocate for someone that doesn't know that is being affected, and they are being affected, and we are being affected too. And you know what? They are us, because we need doctors too, and we have family that need doctors. We are part of the community.
We forget that patients also forget that we're humans and we're patients too.
And they don't know.
No. And so not only do we need to educate the patients about the way medicine truly operates, which is against what most physicians want, because we want more time with the patients. We want to be able to hear their little stories and build that relationship. But then we also need to communicate that to the C-suite, the CEO, the CFO, that look, because of lack of staff, because of the physicians and the nurses and everybody that's showing up, 50% or more have suffer from at least one symptom of burnout, which is going to actually result in worse outcomes.
Worse outcomes in many levels, right? We cannot just let this go. And sadly, the same way that we are talking about this today, there are many, many, many physicians that will avoid this topic, that feel that this is an uncomfortable topic because of ego, because of lack of knowledge, because of fear of retaliation, because they have a big amount of money pending to be paid, and they are maybe too young yet, and they want to make sure that they will be safe and their life will be okay. And some just because of their personality, if they don't touch me, I don't get involved, right? But whatever the reason is, at the moment that you decide not to say something, at the moment that you decide not to turn your face against a reality, you are taking the decision of supporting what is happening and the status quo. Action or lack of action are already an action and are already a decision. And here, or you support good medicine or you support bad medicine. They are not in between. And I feel like it's time for all of us to collaborate and respect each other and feel as a community. If someone in your hospital is being aggravated, is being retaliated, it's one of your students or your residents or someone that is part of your staff, don't turn your face and ignore, because this could be as bad as that person will lose their job. This could be as bad as this person will lose their life. And it's not acceptable to know that 400 physicians die in average every year, and this is even before COVID, by suicide, and the numbers for nurses are not below that, and other healthcare workers. We don't have the numbers, it's just we don't know, but it's happening. So when we turn our face against the situation, when we shut up, when we ignore, we are part of the problem. And as physicians, we promise that we will take care of others, that we will save lives, that we will advocate, that we will be honorable and ethical people, right? So how that correlates with ignoring discrimination, ignoring abuse, ignoring retaliation, how that connects with the reason why we went to medical school. We went to medical school to save lives, to help people, not to let them suffer.
I love the fact that you're pointing out the way that we took an oath to patients. That also does apply very realistically to our colleagues and the ones to whom we're mentoring.
We are human. We are part of that list of patients. We cannot forget that. And our students are, and our family members are, and we cannot forget. It's time for us to recognize that we are as vulnerable as anybody else, but at the same time that we have more knowledge and we have more power because of that knowledge. I don't know who introduced this idea that we don't have power, that we are victims of the system, of the CEO, of the this and that. It's not true. We still have the opportunity to take decisions. Taking decision is difficult. I am a witness of that for sure, sadly, more than once, and for many reasons. I'm terrified of changes. Oh my goodness, I go around my house sometimes, like, in between crying and I'm trying to, hurt the walls, and I'm trying to find my way to go out. It's not easy. For sure, it's not easy. But if you cannot go to your bed tonight feeling that you are proud of your actions, that you are proud of who you are, that you are proud of how you behave in front of, how you can live your life like that. And the next day you wake up and you see yourself in the mirror and you feel embarrassed of what you are doing and what you represent, how we can live with that, because we can fake a happy face and a lot of power and feeling, successful in front of anybody else. But that mirror that is in front of us will not lie and will not believe lies either. So we need to take a decision.
And you've made some big decisions in the last few months.
I made a big decisions in the last several years. I left a good job and a good place and many friends and family looking for this balance between life and work that now I understand that doesn't necessarily exist, but it was uh, a good decision anyway, and I'm happy that I did it. And then I left one job here, thinking that some places are toxic and that you can find, the rainbow in other places inside of the system because there is still hope. And sadly, and maybe I am already traumatized. I hope no, but sadly that was not my experience. And what I see is that the healthcare system in general is sick, and that working inside of it doesn't necessarily fit my core values or how I see myself as a physician or how I see myself as a person. So yes, I quit again my job. As we were talking, it's incredible because I never received so much support. I received awards, I published a book, I went into different podcasts and etc. And I never received so much support as the day that I published that I quit my job. And I saw people celebrating that, what makes us feel that this is a generalized feeling, right? That all of us in different, not only in medicine, but in different fields, we are struggling as workers. And that's really sad. I'm scared like crazy. I am terrified, but I know that what I was doing was not healthy for me, was not healthy for my family. I try giving the system a second or a third opportunity, and I try to convince myself that if I do things a little different and I am more open-minded, that things will look different and will be easier to manage. It was not the case. I cannot wake up and see myself in the mirror, sadly, so I quit.
But you quit something that wasn't healthy for you, something that was not healthy for your family, something that was not sustainable, and that was not true to your core values.
Exactly. Exactly. No, this is seriously not a tantrum. Even at my age, I still have some of them. No, this was not a tantrum, but this was a decision that I saw coming for a few months already, if not more. And that was a family decision. I sit with my kids even, and my husband, my family in general, and we discussed, and we had plan B and plan C, and we started to find out how we will do this. A story that happened and probably was really the reason why I started to not only dream about, okay, at some point I will leave this, but really was the moment that I said, I'm leaving, right? And then other things came after that to solidify the decision and to make it faster. But I was seeing a patient, telehealth patient from my home, and the patient decided to insult me very badly because something that I didn't do, a referral that was not accepted by the insurance, a medication that was rejected by the insurance because of the price, and things that he really needed. I cannot even argue about that. He was upset for the good reasons. He just was venting about someone that, I was in first time in my life that I was having contact with this gentleman, but he really was very rude. And I didn't know that my boy, 7-year-old boy, was in that moment in the room. He came in and he heard all these insults and he started like crying and he hugged me. It's like, why he's telling you all these awful things? So I calmed my kid. I finished that conversation in a most polite way it was possible to. And then I was trying to explain to my kid that really he was upset, etc. It's like, but you are a doctor, mommy. People should like you. And they should be happy that you are helping them. They should not be insulting you. And I was like, yeah, you're right. And he asked me, why you don't quit? Why you have to work in a place where they don't treat you well? And I feel so embarrassed because I'm trying to teach my kids to advocate for themselves. I'm trying to tell them that people need to respect them, that they need to be in places where they well, that they need to look for healthy environment, that they need to treat others well. One example I'm giving to my kid when, he saw that, how I will be able to continue for longer and tell what? Yes, it's okay for man to be insulted.
No, thank you for sharing that, being vulnerable. Wow. No, that's not okay. No, you're right. We have to be the example that we want to set for our kids and for others. We have to remember that we're part of that community and not advocate not only for ourselves, but for our patients, for our families, for our kids.
Yeah, my kids are celebrating.
Yeah.
When I told them, it's incredible. I told them, well, do you remember? Because one told me once, if you don't like your boss, why you are not the boss? And the other, that was the 9-year-old. And the little one is the one that gave me all this speech about you need to be treated well. So my 7 and my 9-year-old look to be emotionally more developed than myself and many other doctors. And when I told them, do you remember that you told me this? And do you remember that you told me that? So I decided to follow your advice. They were, Mommy, we are so proud of you. Now nobody will scream at you. And I was like,
I think a lot of times it's hard for physicians to, let's say we go through medical school and we've developed those skills. I think medicine takes a lot and really suppresses because we're not allowed to really show emotion or it's looked down upon. And I understand being objective, but again, we're humans. We do have emotions, and it's not about being chaotic. It's about being human. So the fact that you're a 7-year-old and your 9-year-old reminded you of that, that's so awesome.
I don't know if the word is awesome. I mean, I'm very proud of them. I'm very sad at the same time that we as physicians and in any other career, we are going through all this. I'm not happy of quitting. I'm not even proud. I'm heartbreaking because I love being a physician. I'm so sad that I need to be escaping from places to find my place, to find my way to do things and feel proud and feel happy and be able to be the physician that I want to be. That should not be the case. I should not be escaping and I should not be crying and I should not be showing these things, the dark side of life to my kids when I want them to love medicine and I dream with them being doctors. Medicine was for me and I wanted to be like that all the rest of my life. It was joy. That's how I want to see medicine. My only way to finally recover that joy right now is escaping from the status quo and trying to create my own joy, my own way to do things from zero, start from zero again, which again is it's very scary. It's absolutely scary, but I will not quit medicine. I will not let the system to win this one. I will win this one and I will be the doctor that I want to be.
I really love that. I really admire that perseverance. And even when you feel like you're in a hurricane, you're learning how to, life is not forgiving, right? Being an adult is hard. But you're learning how to thrive and you're learning how to, you're looking at the silver lining and you have the insight to know what you need and you are patient enough to listen to even ones younger than you, which not everybody is blessed to have those skills. And that's why I say that that's awesome, because you could say, I'm the physician, I'm the mother, I don't want to hear your opinion, but you humbled yourself to take their input and learn from them. And that's something that's so important. I want to applaud you for that.
Thank you. We learn from everyone. And let me tell you something. I'm not doing this by myself. Yes, I quit. Of course, I wrote my email, right? All this process, all these last few months where I have been building plan B and plan C and plan D, right? And I have been asking for opinions and for feedback and for help. And I have been blessed of having people like really helping me and teaching me and mentoring me for no reason, even for no money, to be sincere, just for the kindness of knowing that I am trying to do something that I really believe will be better for me, for my patients, and I am doing it with my heart. And I have been blessed to have people just coming to support me and be, cheerleaders and friends and therapists and coaches and everything. And to be sincere, my husband was not happy about me being an entrepreneur, and he was afraid of, okay, how we will do this and that. And let me tell you, right now, he is teaching me and helping me. And I am so grateful because we don't grow by ourselves. We don't jump into pools and find water if there's not people around us putting some water there. And we need to forget our egos. And a physician doesn't make you a super, hero. We need to forget about that, and we need to start allowing others to help us so we can find a good life finally.
You're not one to back down from challenges, moving from Peru to the US, redoing residency and then switching jobs and now becoming an entrepreneur. That is not for, you're not weak. You have a great spirit. And like you said, it takes people. So no, you're not just doing it by yourself. But thank you for highlighting the ones that have helped you, because that is a big part of, we always forget that.
Yeah, we what happens is that we see the end of the story, right? We see these powerful people driving these awesome cars and having these mansions or whatever, or appearing on TV shows or whatever you consider success or being famous, right? But we don't know what they went through. We don't know how many rejections they received. We don't know how many nights they were crying, or if they, they got sick, or if they didn't have 1 cent in the bank. We don't know that part. And I believe that that's the part that we need to tell others is we don't, I personally, I'm not starting from a very well place. I am a normal person. I am learning in the process. I'm scared like crazy. I am getting the help of people. I am asking for the help. Not only that I receive it spontaneously, but I am going and asking for the help, which is difficult. And that's the only way. That's the only way. And if we really want to get to a place where we will feel happy and healthy and comfortable, we need to be proactive and remove ourselves from our comfort zones, even if that includes, right, to remove our egos too, and to get dirty too, because it will not be, I know it will not be easy. I get that. It will not be easy. Emotionally, it's not being easy. But I will do it, as I did many other things in my life. And if I can do it, anybody else can do it. And this is not a question of quit your job and do something or be an entrepreneur or write a book or whatever. It's just look for what you want, look for who you are, for what makes you proud. And in any career, in anything, you can be a stay-home mom, right? And that's probably the most difficult challenge, if you ask me. It's easier to be a physician than a mom. But find who you are, find what makes you happy and proud of yourself, and go for it. Because life is one, right? And I don't want to be at the end of my life regretting what I didn't know because I was on fear or because my ego didn't allow me to ask for help.
Oh, thank you for that. And truly thank you for that, because it's absolutely, we only have one life. Live it, do what makes you happy. So where can the listener get a hold of you and even purchase a copy of your book? Because it is full of just pearls of wisdom, just like this episode.
Thank you so much. So part of my change, and this is so funny to say, this is the first time I will be saying this live. So part of my change involves leaving or leaving just the bubble of LinkedIn. And now I am opening a Facebook account and a Instagram account, MD, for both. And you can find me there, or you can find me on LinkedIn, and the book is on Amazon. And yes, even for that, I am being new. So I am collecting new friends from zero in Facebook and Instagram. It's part of all the process. Start from zero even there, and transform myself in someone better and happier, and better version of myself.
Well, I look forward to following you on the other two platforms, Instagram and Facebook, because I already follow you on LinkedIn. You're very positive. I have read parts of your book, and I just want to thank you for the work that you're doing and for being an advocate for not only physicians, but for the community and for patients. Your social handles and your website and your book will be in the show notes. So any last tips or pearls of wisdom for the listener?
This is not mine. This comes from my boy, Ellie. He told me this, and I believe that that's the most amazing mantra to live your life. He told me once, this is your life, this is your choice, this is your journey. And I believe that that's magical because that empowers us to live the way that we want and to pursue our dreams and to be proud of what we are doing.
Miriam, thank you so much for your time and for your great message.
Thank you. And I wish all of you guys that are watching this that you will have beautiful lives and that you will be able to find a way to be loyal to yourself and be proud of yourself.
If you have enjoyed this episode, click subscribe, share it with a friend, because we could all use a little bit of normalizing the topic of burnout, knowing that we're not alone.